Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Ozempic, Wegovy, Monjouro, Zepbound, chances are you know someone who is using one of these injectable weight loss drugs. According to a recent EPIC research study, prescriptions for these kinds of medications have increased 40-fold over the last 5 years. They belong to a class of drugs called GLP-1s that work by mimicking a hormone that stimulates insulin production and induces a sense of fullness after eating a meal. But what kind of effect can these weight loss injectables have on your heart? Do the benefits outweigh the risks when it comes to cardiac care? We'll answer those questions and more with Dr. George Sokos, Interim Chair of the Department of Cardiology at the WVU Heart Vascular Institute. Welcome, Dr. Sokos, to Live Healthy West Virginia.
Thank you for having me. Looking forward to it.
It's always good to have you here. Okay, so let's start first with what exactly are these injectable weight loss drugs and how do they work?
Yeah, so GLP-1, or it's glucagon-like peptide, that's the fancy term for it, but no one uses that. It's too hard to remember, right? So it's something your body actually already makes itself. Okay, so it's kind of like a hormone that helps your body to understand when to secrete insulin to help lower your sugars, when to tell you to stop eating, those sort of along with your brain. So it's a naturally occurring substance in your body. So these drugs basically have they mimic the effect of the naturally secreting substance. Okay, so they basically put the levels a lot higher than you would normally have them, and so it suppresses your appetite, it lowers your blood sugar. By helping you to secrete insulin. So they're first used, and still are used for that matter, for diabetes control. That's
where they started.
That's where they started, right? So, but what we found when we started looking at them is, wait a second, people are starting to lose weight, and so we thought, okay, well, can that be something that we can be used for as well? And then here we are several years later, and we see that yes, indeed, there's several trials that have shown that they can help you to lose weight. Well, that's great, and people definitely want to lose weight, right? Because we think, okay, that should promote better health and better outcomes. But we didn't know that until recently, when a large trial was presented at the American Heart Association in November, which showed benefits to the heart, basically cardioprotective benefits. So less heart attacks. There's actually another trial that was published there as well, looked at improvement in heart failure. So there's a lot of different effects that these drugs can have that benefit people who are taking them.
Okay, so what do you think is helping the weight loss? Is it simply the weight loss that's helping the heart, or is there something in these drugs that's not only enabling weight loss, but helping your heart?
Yeah, we think it's both. But definitely weight loss has a role, but if you look at the study, there was protective benefits on top of the amount of weight loss. So, and actually, when these drugs were initially approved for weight loss, there was a cutoff for your body mass index, or BMI. So when you go to the doctor's office, they measure your height, they measure your weight, and they calculate this BMI. And for the initial trials, it had to be greater than 30 to be used for weight loss. Okay. But when they looked to this trial, they said, okay, we don't want to go that high. Let's go even lower for just the mildly obese patients. So someone at a BMI of 27, because and that actually is not even obese. In that category, you're considered just overweight. So 25 and below is normal for a BMI, and when you're 25 to 30 is just overweight. Okay. So not even technically obese.
Okay, so 30 and above is obese.
Correct.
Okay.
And you get above 35, you're considered morbidly obese.
Okay.
And then there's all these other categories now for people who are even higher than that.
Oh, wow.
So we work with our colleagues really closely, Dr. Davidson and the Medical Weight Loss Clinic, and with our endocrinology colleagues here, so to utilize. That's because that's where all these medications were initially used. But now we're using them more and more in the cardiovascular space to help protect and move things forward. Actually, when I was a fellow, let's go back in time. Well, we're actually it was actually pretty exciting. So if you go back to 2004 when I was in my training, I actually studied GLP-1 in patients who were having heart attacks. I got a grant to look at it in patients who were having cardiovascular surgery, bypass surgery, and we showed improved outcomes in those patients and in patients with heart failure back then.
Wow.
So, and then it kind of dropped off, and now here we are again.
Full circle.
So I'm really excited about it personally because I dedicated about 5 years of my life to these things. So
wow, wow. Okay, well, now is the one study that you were mentioning, the large study, is that the one that was sponsored by Novo Nordisk?
Yes.
And they are the makers. Now, full disclosure, they're the makers of Wegovy and Ozempic.
Correct.
Now they funded the study, so should we take some of the findings with a grain of salt?
No, because these studies, yes, they fund them, and yes, they help to design the study, but they have to go through the FDA, and they have to go through a rigorous process, even to get before it gets published or presented like this. There's certain criteria they have to meet, and the FDA won't let it go through if the trial doesn't meet certain standards. So, yes. It benefits them for these drugs to get approved for different things and to show this benefit. But I mean, I think the scientific rigor that goes along with these trials is extremely, high, and I feel very confident that they're beneficial. And there are several people not involved with these trials feel the exact same way. Everybody's extremely excited about these trials. And when you look at it we look at all trials. When I see a trial is published, I try to criticize as much as I can. Okay, what were the good things about it? What were the bad things? What did they set it up just so they would absolutely show a benefit? Did they skew it so that they're going to, and this trial was definitely not that way. It was no. This was, matter of fact, they made it harder for them to show the benefit, and they still showed that benefit. So, I'm very confident that we're going to continue to see these benefits in our patients.
So, do you think this could change the standard of care for heart patients?
Absolutely. I think within the next 5 years, you'll see anybody who's overweight or obese, we'll start doing that as part of our preventative strategies. I think that, I don't know that for certain, but that's where I see it going. It's going to be important, though, how we do that. We're going to need more data before we do that because these drugs are extremely expensive. And it's not just if you have to pay for them yourself, but your insurance companies, we have to be smart about how we do things and not just put someone on an expensive drug, right? I know when I see patients every day, particularly, I'm my regular job, I'm a heart failure cardiologist. We have several medications that are extremely expensive. And we have people on at least 5 medicines for their heart when we have someone that has heart failure. Wow. And that can be extremely expensive. And then we add this to it, and then boom, boom. And even if it is covered by their insurance, their co-pays can be astronomical. So we have to be smart about what we do and make sure that these things are going to be cost effective. But I will say this, that the cost of a drug is much less than the cost of someone going into the hospital, having a heart attack, having a stent, having bypass surgery, God forbid dying. There's a lot of things that you have to come into play, but it's very difficult. And I do understand from an insurance perspective why people from the insurance companies are a little concerned. Yeah. Right? I mean,
yeah. So let's hold on a minute, right?
Yeah. So, but I think we'll see more and more data coming out with other trials because, that trial that we're talking about was sponsored by the makers of Ozempic and Wegovy, but there are several other Me Too drugs out there that I think you'll be seeing their data as well. And then we'll start to establish, these protocols on what to do, national guidelines, so to speak, right? We're not there yet. They haven't fallen into our guidelines, but, I don't think waiting for a guideline to tell you to do something is not necessarily the right thing to do. It's important in that it gets to the masses. But if for example, let's say we know someone in your family had a higher risk for heart disease, and I wanted to be super aggressive with you and you were overweight. That's a person I think right now that we feel real good about starting one of these medications. Because we think we have enough data in a higher risk person. Those are people we would normally put on statins and things like that to show some benefit. But other risk factors are extremely important too. So it's not just the drugs, right? We have to work on a healthier diet, exercise, cholesterol. There's lots of things that we do to try to minimize the risk of heart disease.
Well, there was a New York Times article where a doctor was quoted. He was the division chief of cardiology at Northwestern Medicine in Chicago, and he said, "We just identified a new best practice."
I think that was Clyde Yancey, if I'm not mistaken. So
yeah.
So I mean,
and another doctor said that this could have as strong effect as statins when they first came out with cardiac care.
And that's why I say everybody's just extremely excited. And from a preventative standpoint, I think we need to be more proactive than reactive. It's cheaper to be proactive than it is to be reactive. I can tell you that for a fact. And it's not just that. So I just talked about the cost of taking care of someone. I didn't talk about the cost to missing days of work when you're sick, not being able to work when you're sick, other things downstream. There's a lot of things that are at play, and which is why companies and people who pay for your insurance, they're saying, okay, this probably is going to be beneficial for us to do this, because it's not just saving us in what we pay in healthcare, it's saving us on our end.
Right.
So those are things that we try to keep in mind.
But what about long-term effects? I mean, we really don't know what the long-term effects could possibly be.
Yeah, I mean, so the biggest concerns, when they looked at these, when they studied these in rats, and I did that too.
That was fun.
So we won't go into that. I try to block that out of my mind. But the concern was, can it cause thyroid cancer? Because there's black box warnings on these drugs. Don't worry about that. And can it cause pancreatitis because it stimulates insulin production? And those are very low risk things that can happen. So we think, this was 5-year outcomes, which is standard of things that we do. Those risks are relatively low.
Okay. Are there any long-term effects you think that we should be looking, that researchers should be looking for as a possibility concerning the heart? Yeah,
those things I think what we know is it has not increased any risk for cardiovascular disease from what we know right now.
Right now, okay.
Because there was some concern could it increase risk? Does it decrease risk? We don't know. My bias has always been that it's going to improve things based on my previous experience with things. But I think right now the benefits far outweigh any kind of risk. Okay,
so what can you tell us right now? Give me a risks and benefits comparison. So what we know right now? What are the benefits to the heart, and what are the possible risks to the heart? And does one outweigh the other?
Yeah. So I would say benefits are decreased amounts of heart attacks. This is limited data that we have right now. Okay. So
this is what we know so far.
Yeah, with not a ton of trials. So we've got to take this with why we're excited, because this is what we've seen so far. We've seen decreased heart failure admissions, decreased not just heart attacks, but need for stents and those kinds of things. Again, that wasn't really in that bigger trial, but those are some other smaller trials that people talked about that. Again, that one I'm not sold on. Okay, but I would say the biggest thing that we know is weight loss, decreased heart attacks, and admissions to the hospital. I think those are the biggest things that we can feel good about. Okay. Risks are really more side effects related than anything. These drugs, you don't need as much, but you don't need as much because they make you some can make you nauseated. They can cause constipation. They can cause diarrhea. I mean, there's a lot, because they work on your GI tract. That's where they focus. Right. And so all those things are real, real things to worry about. And we talked about the theoretical risk of thyroid cancer. It's so low that we're not even doing a ton of screening to do. So what we do worry about is someone has a family history of a certain type of thyroid cancer, then we won't start them on those medications. You're not supposed to do that. So those are important history questions to ask is, do you have this history of this kind of cancer? And if they do, then you don't do it. The other, the other worry is, can it cause pancreatitis because of this increase? And again, we use these all the time. I've yet to see that. But it happens, or it wouldn't be reported. So
Okay.
it's not like it doesn't happen. It's just it's pretty rare.
So in your opinion right now, do you think the benefits outweigh the risks?
I do. I prescribe it a lot.
Did you prescribe it for your family members
Absolutely.
or yourself?
100%. Yeah, absolutely. I
Right.
absolutely recommend it. I mean, I shouldn't be afraid of it. I think, I will say this, I know this, people have I've seen less side effects, even though they're real and they happen.
Mm-hmm.
They're tolerable.
Mm-hmm.
And people tend to tolerate them sometimes more than even statins. We use statins all the time. And as you know, people complain about some muscle cramping and pain, and that's a real thing. I'm not downplaying that.
No.
Typically, we can work through those and find ways to still use a statin in most patients. But and same with these drugs. You just sometimes have to be slow on the dose, because we start on a really low dose, and to get to the highest effect, you have to get to a significantly higher dose, and that's when more of the side effects come in.
Okay.
The
So
higher the dose,
higher
more
the
side
dose.
effects. Yes, ma'am.
Okay. Now, the other thing about these drugs that we've read about is that, okay, you may have to be on these the rest of your life if you want to maintain the weight loss, because if you stop taking them and you're not making lifestyle changes,
Right.
you're going to gain it all back.
Yeah.
What? I mean,
Most likely the case. I'll say this: what we've seen sometimes, I will say, I haven't stopped it too much when someone got to a goal weight. It's kind of maintained it. But some people feel there's an oral form of these medications that some people think they're not as strong, so to speak, as these. That there's a thought process out there that if you switch them to the oral form, that's a couple times a day, that may be a maintenance phase. We don't know. The real answer is we don't know.
It's still early.
The real answer is we don't know. Most likely, I would say you're going to need to stay on it or take some breaks, go back on it, that kind of stuff. But for the cardio protection, and I would say that part of it, I would stay on it, right? Because you take it away, then your protection goes away, we think.
Oh, okay. Okay. Yeah, that would make sense.
So again, we don't know that. Those are things that we need to learn more about. Do you still get that benefit if you stop taking the drug? We don't know. We really don't know. And so I don't think we didn't start off by saying they're definitely injectable drugs, and the needle's about that small, and you can inject it in your belly, and it's a once a week injection, and so it's not an everyday thing. So it's a once a week injection at this point.
So who would you consider a good candidate for these drugs? I mean, are they for everybody?
I think we have to be very careful about that. I think, for sure, if you're at higher risk for developing heart disease and you're overweight, those people. If you're diabetic, it's already indicated for that. I think the patients we're worried about is the people who are not diabetic and who are overweight. Those are the people, those are the costs that could be astronomical, because there's so many people that are overweight. Those are the ones that we have to stop and think, okay, which ones do we really want to be on these medications and which ones do we not, and how do we risk stratify those patients? And I don't think it's clear yet, but I think, if we know that someone's at higher risk for developing coronary disease and having a heart attack, and they have a family history and they're overweight, I think those would be my first priority. And then I'd kind of go down to others.
Okay. All right.
It's not clear, but I think that's how I look at it right now. And because we have data for that. But I think it could change significantly over the next few yeat I don't think it'll be too much longer before you see more data coming out.
Well, and it just seems to be building momentum in the medical community, because I know even here at WVU Medicine, we offer a program for our employees to use these medications for weight loss.
Again, and that is just looking at weight loss. That's not even looking at our side on the heart side, right?
Yeah.
That's working with Dr. Davidson in the medical weight loss clinic, who are fantastic, by the way. I sing their praises every day, because I think it's an important team concept. There's more to just weight loss than taking these drugs. There's the psychological aspect of things.
Right.
There's there's all kinds of things that go into play for weight loss. These are just a nice bounce, to get you started and give other benefits. I don't mean that, right?
Yeah.
So, but I think it's a lifestyle change. It's important, right? That you just don't take the drugs. They're important too. I mean that they have their benefit. But again, our endocrinology team uses it for diabetes. It's very beneficial there. People definitely lose weight. Their sugars get better controlled. With that, their risk goes down. So I think we know very well in those patients they're good to use. So if you're diabetic, and not on there's whole other criteria for that. I'm not going to go into treating diabetes because that's not
your specialty.
Yeah, although we do a lot of it, right? But I will say that we know those are the areas that are extremely good, to use these medications. And it's the other ones where we have to figure out more details and more data, and we will. And I think there's a lot of opportunity. I mean, we want to help. We want to improve the health of all West Virginians, right? I mean, that's our goal. That's our goal. That's why we're here.
Yeah.
That's why we have our jobs. That's why we work for the university, to be able to have that impact.
So you think 5 years down the line, this is going to be right up there with statins?
That's my prediction. We'll learn a lot more in that time, I can tell you that.
Yeah.
Ask me in a year. I'll see.
Yeah. Well, before we go, what's the most important thing you want our viewers and listeners to know about weight loss, injectable drugs, and heart health?
So I think the most important thing is to talk to your doctor about these things to see, is it right for you? It's because it isn't right for everybody. There are certain things. I only touched the main things of why not to use these drugs. There may be other reasons not to, and that's why you need to talk to your individual provider, to go over those sorts of things. So I think don't be afraid of them. I mean, they can be extremely helpful. They're useful. They can provide you a protective benefit to your heart. I mean, that's what we're, I don't want to have to treat anybody with heart failure. That'd be great. I'd like to be out of a job from that aspect of things, right? But that's not the case right now. So if there are things that we can do in the cardiovascular community to reduce people's risk from developing more life-threatening diseases, then we want to do it. We want to be ahead of the curve. We don't want to be reactionary. Again, we want to be very proactive if we can.
Good to know. Good to know. Thank you so much for sharing this information. I mean, this is a hot topic.
It is. I feel like I'm in my own clinic right now when we're talking, because this is the conversation I have with our patients every day.
Every day.
And it's important. I think the other thing I would tell patients is, if someone just wants to put you on something without talking to you about it, you should demand more. You really should. It's important. Because you need to understand why you're taking it. Talk to your pharmacist too. If you get prescribed them, your pharmacist is a great resource. So. All
right. Well, good to know. Thank you again so much for sharing this information. I think we've helped people sort things out today.
I hope so. Thank you for having me.
Good to have you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on heart issues, you can always visit wvumedicine.org/heart. And if you want to find the latest episode of our podcast or all of our episodes of our podcast, you visit wvmetronews.com/podcast. I'm Mary Ravazio Menard, and on behalf of Dr. Sokos and everyone at WVU Medicine, thanks for joining us.